Scenario, you have been asked to take history from female patient hospitalized due to total hip replacement. Nurse noted confusion. You will not ask for name or age or past medical or surgical history, drug history, family history, ideas, concerns, and expectations. Other system review. How are you feeling today? I'm feeling a bit confused, dear. Would you mind if I asked you some questions to test your memory? No, I don't mind at all. All right. How old are you? Oh, I'm not quite sure, dear. What time is it to the nearest hour? Um, I can't seem to remember. Can you remember this address? 24 West St. I will ask you this at the end. 24 West St. Hmm. I'll try to remember, but it's slipping my mind. What year is it? Oh dear, I don't quite recall the year. What is the name of this place? I'm not sure, dear. What is my job? And what is the job of this person, e.g., a nurse? You're the doctor, and the nurse helps take care of us. What is your date of birth? My date of birth? Oh, I'm sorry, I can't remember. When did WW2 end? WW2, I think it ended a long time ago. Who is the current prime minister? Um, I'm not quite sure. Can you count backwards from 20 to 1? 20, 19, 18. What was that address I asked you to remember? 24 something, right? Thank you for your answers. I will need to conduct further assessments, such as the MMSE, to better understand your condition. Present your patient. I've assessed Miss Juliana, who presented with symptoms suggestive of cognitive impairment. She demonstrated difficulty with memory recall and orientation to time and place. Additionally, her responses were indicative of confusion and disorientation. Her AMTS score was 2 out of 10, suggesting potential delirium or dementia. Further evaluation with the MMSE will be necessary to determine the severity of cognitive impairment and establish a diagnosis. How will you manage this patient? I will do a full clinical examination first. I will observe her closely using National Early Warning Scores, NEWS, monitoring of vital signs, BP, pulse, temperature, respiratory rate, and oxygen saturation, and level of consciousness. How will you investigate this patient? Blood investigation, FBC UNE, LFTs, TFTs, calcium glucose, B12, plus folate, urine dipstick and culture, imaging, CT head, CXR. Will you allow her to go for surgery? Fitness for the operation? Why? No, because 1. She is not fit for giving a consent, as she cannot retain information, cannot make an informed decision. 2. The operation is non-urgent. If this case is an emergency, will you allow her to go for surgery? Yes. As the patient lack capacity, consent should be recorded using Consent Form 4 with 2 consultant signatures. What is MMSE? Mini Mental State Examination is a 30-point questionnaire that is used to measure cognitive impairment. Tell me 2 tests to be done on paper to assess capacity. Ask patient to draw intersecting pentagon. Ask patient to read and obey a written command. Q. What is capacity? Capacity refers to competency, which entails the ability to understand, retain information, believe information to be true, and make decisions accordingly. Thanks, doctor. You can proceed to the next station.